In just a few moments, Dr. Deborah Birx will outline the data that we're seeing around the country. We're tracking literally state by state, county by county. But as she will describe in a moment, we're actually seeing early indications of a percent of positive testing flattening in Arizona and Florida and Texas. Governors in each of those states have taken strong steps to flatten the curve. And again, as Dr. Birx will describe, we're beginning to see early indications that positivity is flattening. And in Arizona and Florida, we are beginning to see declining numbers of emergency room visits as well. We believe the takeaway from this for every American, particularly in those states that are impacted, is keep doing what you're doing, because we're starting to see the first indications that, as we were able to do in the Northeast, as we were able to do in New Orleans and Louisiana and Michigan and other places around the country, we're putting into practice those mitigation efforts, and we're beginning to see indications that they are having a good effect. We are focused on the states where more than half of the new cases have arisen: Texas, Arizona, Florida, and California, and have received encouraging reports even through this morning. Strong supplies of PPE in hospitals. Hospital capacity remains strong. The one need that we did hear from governors across the region is for personnel. And over the last week, working through FEMA, the Department of Defense, and HHS, we've been processing requests to deploy over 1,070 doctors and nurses and medical personnel. At this point, roughly 525 doctors and nurses are on the ground in Arizona, California, and Texas, and we're processing a request from Florida for an additional amount. We've made it very clear, as we, if you'll recall, we deployed at the President's direction active duty military medical personnel to New York, to New Jersey, to Connecticut, to Michigan, to Louisiana, and we're in the process of doing that again, just to make sure that, that those dedicated doctors and nurses and healthcare workers have the relief that they need as we see cases rising in various communities across the Sun Belt, and we'll continue to work that.
I want to start with Arizona, just to pick up where the Vice President left off. That orange line is the number of tests performed, and the blue line is the test positivity. Now, this is at the level of the state, and Arizona does have 3 counties that we're tracking very closely. Obviously, you know, the largest one being Phoenix and Maricopa County. But this does show that the blue line, which is a 7-day average, and thank you to the data team for these wonderful slides, the 7-day average is showing some flattening, and they find that encouraging. Also equally encouraging at this point, because we know that the test positivity rate is the first thing to increase. And we're hoping that it heralds a stability in Arizona of at least reaching a plateau in their curve. The red line represents the emergency room visits for any of the COVID-like symptoms. And this is also an early indicator, and we find that encouraging. The next slide does show the counties that we're tracking, obviously the largest county being Maricopa County with the largest number of infections, but clearly there's issues in Yuma and Pima. The Vice President mentioned the weekly reports that go to governors. This is what the report looks like. Of course, they're full-side pages. This is Alaska's. On the front page is our interpretation of what we're seeing relevant to their epidemic, with specific recommendations related to where we see them as far as being in a danger zone. They are coded by yellow and red. And it follows that they see everything you're seeing on that first report in boxes, warning boxes, and then each of the counties are represented so that they have in one place 5 pages from the White House and task force that summarizes what we're seeing, and that goes out weekly. So I want to finish with where the Vice President started about the sacrifices of the American people, because in that recommendations are very clear recommendations that when you have a county with these types of cases, we are recommending everyone using a face covering. And I think the studies now that have been done showing that cotton face coverings work, that does open up the ability for us all to have individualized face coverings that express our personality. But in addition, I think the work that these governors have done to and ask the American people to stop going to bars, to close the bars, to move to outdoor dining, to decrease any kind of indoor gatherings, again, to all of the Americans out there that are in these 4 states and the states that have, in the report, we're in the red zone because there's a series of other states that we have in that zone, is really asking the American people in those counties and in those states to not only use the face coverings, not going to bars, not going to indoor dining, but really not gathering in homes either, and decreasing those gatherings back down to our phase 1 recommendation, which was 10 or less.
The last thing I want to talk about is Phoenix, and I don't know if we have the slides for this. I get just a little bit concerned when I hear things in the news like we're doing nothing for Phoenix and the federal government hasn't been doing anything with Phoenix, because that really is not correct and it undermines a lot of the things that we're doing. I'm going to show you some slides. I didn't make these slides up. My team, this was part of a 55-slide deck just on Phoenix, where we understand the demographics, the health disparities, the income levels, the racial and ethnicity backgrounds, where the tests are done, where the resources are. This is how we really work the issues. So first of all, we're in constant contact with Governor Ducey and his team. His state health officials are outstanding. We not only talk on the calls, but we have frequent calls, and I know Dr. Redfield does this as well, and Ambassador Birx does this as well. Number 2, we provide support according to the state plans. Just in the last 2 months, we've shipped over 500,000 swabs and media to the state to fulfill their plans. In terms of Phoenix, if I can get the first slide back, please. I just want to say that, yes, we have lots of support in Phoenix. This is the community-based testing locations. I didn't decode this because it's right out of my slide deck. Phoenix has 3 federally funded retail sites. This is paid on a per capita basis. You come up, get a test. These sites, not these 3 sites, but this overall program has tested just under 1 million individuals, and they're located specifically in communities of high social vulnerability. We have 3 there. We also have 13 what we call 3.0 sites. These are retail pharmacies that, because of our regulatory flexibility, they can do that without a federal stipend or grant. They do this just through the insurance, Medicare, and Medicaid billing system. So those are 16 federal sites we have in Phoenix. Next slide. I don't know if there's a map to go with that, but under the leadership of Secretary Azar, we've really surged into FQHCs, federally qualified health centers. This is where you really want testing to happen, because these are medical homes for those who are indigent and underserved. We have 28 FQHC sites performing testing just in the Phoenix area right now. Next slide. We don't have that slide, but let me talk about, we've also identified every single testing machine in Phoenix. So there are testing machines to do tens of thousands of tests per day, and we're sending at least 100,000, okay, maybe it'll come up, maybe it won't, but at least 100,000 assays to the Phoenix area every week. So these are all the things we're doing in the background that happen on a regular basis, that we do community by community by community. Now, 2 days ago, I heard that Mayor Gallego was unhappy because there was no federal support. I heard that on Monday morning. I was on the phone with the FEMA representative in the afternoon. It was clear to me that Phoenix was not in tune with all the things that the state were doing. We convened a call last night where we had Governor Ducey's people on the phone, where we had the mayor's people on the phone, where we had various health officials on the phone. We got everybody together, understood where the gaps are. There's a surge from Arizona State. There are a surge in testing sites that are state testing sites in Phoenix that are up there. And this morning, Governor Ducey looked at everything, thought a surge site would be helpful in West Phoenix. He requested that, and we're contracting that right now. So I just wanted to give you that example because it really pains me when somebody says the federal government isn't doing anything, when we have 41 federal sites there. We're sending supplies, we're sending tests, and we work with the governor every day. And if there's an appropriate request and it's on the list for Dr. Birx, which it was, we will send a surge site, and that's what we're doing. We're contracting that this afternoon.